The FBI, Interpol, and the Ontario Provincial Police are now helping to investigate a ransomware attack on 5 Ontario hospitals. The IT provider for the facilities says patient and employee data is at risk. Albert Delatala is tracking this story for us and joins us now. So, Albert, tell us more about this ransomware attack.
Well, a big worry here, Diane, is that the likely sensitive data stolen in this ransomware attack, like medical records, could be published. And the 5 hospitals affected and their IT company are now confirming more than a week after it happened that this was a ransomware attack. The IT company Transform and the hospitals issued a joint statement saying, "We continue to work around the clock to restore systems, and we expect to have updates related to the restoration of our systems in the upcoming week." They said they're working closely with law enforcement, as you said, including Interpol, the FBI, and local and provincial police. The impact here has been serious, severely affecting operations at 5 hospitals in southwestern Ontario, including the Windsor Regional Hospital. It's forced them to postpone appointments and surgeries, including for cancer care. Staff say they can't access patient records. They're using pen and paper now. The Windsor Regional Hospital, they said today it's in the process of implementing ways to run its radiation machines without the equipment that was compromised by this attack. The hospitals say people impacted by the cyber attack will be notified, and they're saying they're doing their best to contact patients whose appointments need to be rescheduled.
Wow, lots to think about there for the patients. I'm sure a lot of people are quite concerned. But are we hearing anything about how this sort of attack could be prevented in future?
Yeah, we are, and one technology expert, he actually told CBC that this could be an example of the coming storm of problems involving hacking and hospitals and patient data. So he says this is, he says this is evidence that the public institutions like hospitals and government agencies need better action plans to assess, to address cyber attacks. He says steps need to be taken now to ensure this doesn't happen again.
An ounce of prevention is worth a pound of cure. Having really robust security systems, putting in measures to ensure that phishing attempts and ways hackers can try to compromise systems get blocked. That's really important, especially dealing with government agencies like hospitals. We always criticize governments as being inefficient and dim-witted, and I hate to say it, I think hospitals and governments can do a lot better here.
And he's also underlying that we aren't just dealing with banking information here. This is medical information potentially containing very sensitive details on patients' medications, ailments, mental health issues. He wants the province to ensure that the affected patients here, that they're supported. And he wants all hospitals in Ontario to take better steps to better secure their health records and make sure they stay private. Diane.
All right. Thank you so much, Albert.
You're welcome.